Well, thank you both for joining me, Dr. Omar Noor and Mark. Thank you for being here to talk about psoriasis. Dr. Noor, I'm going to start with you. First of all, I'd love to set the platform. What is psoriasis, and how does it impact people physically and emotionally?
So, psoriasis is an inflammatory skin disease. It starts internally, and that inflammation, it manifests as thick, silvery, scaly plaques on the skin, very typically on the elbows and knees, but can really affect anywhere on the body. And it can be itchy and very uncomfortable. And a lot of times when patients come in, they talk about really the perception that people have of them, whether their rash is contagious or they're shedding on the floor, and it really affects patients emotionally as well as symptomatically.
I want my audience to know that Dr. Noor, he is a board-certified dermatologist and has many years of practice treating this and other skin diseases. Dr. Noor, what treatment options are available then that can benefit my patients if they go in office?
So there are topical treatments, there are oral treatments, and then there are biologics. And a biologic that I have had a lot of good experience with is a medication called Ilumya, which is approved for moderate to severe plaque psoriasis and offers the ability of 4 in-office injections per year to get your psoriasis under control.
I'm going to switch to Mark. Mark, I'm going to ask you as a patient advocate, tell me a little bit about what you know about psoriasis, and tell me how my audience, if they have this, how do they advocate for themselves?
Okay, well, that's a great question, and my experience started out in about 1962. When I was 7 years old. And so as I've been able to kind of go through life, I've been able to watch the advancements in medicine and see what researchers have been able to come up with. I swear for decades and decades, the only thing I was able to really use would have been the topical steroids. And I was covered 90 to 95% on my body, and, the topical steroids just didn't do it for me. I mean, the topical steroids barely kept it under control for me. And, you fast forward to today, and now that we have these biologics, like Dr. Noor said, 4 injections a year, and my skin is clear, with the exception of a little spot on my forehead and some psoriasis in my ears. So we've come a long ways.
That is a long way, Mark, and I could feel your pain when you were talking about it. I can imagine being covered over 90% of your body with something that itches and flakes and all of those kind of things. So as my audience takes this journey for themselves, how do they maintain a relationship with their healthcare provider during this treatment journey? Because it seems like you know.
Well, I'll be honest. In the very early days of my psoriasis, I didn't have a real good relationship with my doctor with my dermatologist, because there were so few effective treatments. But if you go back the last 25, 30 years and the advancements that we've seen, you're just not thinking right if you don't develop a good relationship with your dermatologist, because there are so many treatment options that are available now, and there's no reason why anybody should have to suffer through this.
I want to thank you for your firsthand account of how to advocate for yourself, and thank you for sharing your story. Dr. Noor, what should patients do if they struggle with psoriasis? And maybe they struggle for a long time like Mark.
This is right. And this is unfortunately something that we see often in my practice. advocating for yourself. If you have symptoms of psoriasis, if you feel like you have any issue, go to your dermatologist and really advocate for yourself. Talk about your story. We've been benefited from more treatment options, learning more. Even as physicians, the understanding of psoriasis has expanded. For instance, we know that psoriasis can present differently on different people. In darker skin, psoriasis tends to be a little bit more difficult to identify. The erythema, the redness tends to be a little bit more violaceous and purple. And sometimes darker skin patients are diagnosed a little bit later. So you have to make sure you advocate for yourself, get treatment early, and really just find someone that works with you to make sure that you guys are on the same path to get better.
Dr. Norris, I'll let you and Mark go. Is there a place online that my audience can get more information? You've given them the inspiration.
Yeah, so www.illumia.com/ILoveYa, and that's ILUVYA.
I want to thank you both for talking about something that many in my audience said they could identify with. So being my guest on the Valder Beebe Show, I appreciate it.
Thank you.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.